This is Mulder's sign. Patient is short along seated, and you're grasping the distal metatarsals. And with a pencil eraser, you're just going to go in between each metatarsal, and you're looking for click, pain, or reproduction of symptoms of numbness, tingling, and paresthesia into the toes. That would be a positive test, and the implication would be an inner metatarsal neuroma.
All right, I'm going to remove your shoe now. Okay, and your sock. So I noticed that your toes are a little blue and cold, so I'm now going to check your pulse, okay? All right.
So we're going to move on. At first, I'm going to check the hair distribution, and it is shaven. Temperature is warm and dry. I'm checking for edema, and we check pitting, non-pitting, and then rate. There's none noted, so it's 0. We're going to check for pulses. Dorsalis pedis, noted 2+, and posterior tibial is noted 2+ as well. And then I'm going to have you we'll go ahead and do against resistance since you're sitting. So I'm going to have you push up against my hands and against. Perfect. And that is full and 5 out of 5. I'm going to have you, we're going to check the capillary refill, but your toenails are painted. So we're going to do it on your big toe, and it's less than 2. We could also check on her nails as well, like we did, and make sure. And I'm going to also palpate her heel and check if it's boggy or if there are any pressure ulcers. Perfect. And I'm going to go ahead and have you stand for me. I'm checking for symmetry of hips, knees, and ankles. And we're going to do range of motion. So I'm going to have you flexion, extension, flexion, extension, and we're going to do dorsiflexion, plantar flexion, dorsiflexion, plantar flexion, and then eversion, inversion, eversion, inversion, eversion, inversion. Perfect.
And review this questionnaire along with the patient's background and risk factors in order to assess whether or not non-invasive testing is necessary. When the venous exam is scheduled, it's important to let patients know that they cannot smoke for 30 minutes prior to their appointment. Because pressure cuffs need to be applied directly to bare legs, the patient should also be informed to bring their own clothing that is suitable for the test that is not constricting, such as gym shorts. When a patient has changed to appropriate clothing and is ready for the exam, they should rest for 3 minutes in a sitting position on the edge of the chair. Have the patient complete at least 5 dorsiflexions or more. Tell them to stop once the waveforms show that the blood has evacuated.
Any chance you can pull her up?
There's no chance.
No chance.
I don't think.
Yeah.
How?
Maybe we'll have to use my knee as a model.
Yeah, mine's not going up. I don't think I can.
Oh, it doesn't work. All right, how's my knee model here?
Doing Mulder's sign, testing for Morton's neuroma. I'm going to place my fingers above and below the space in between the metatarsals, 3 and 4. Palpate around in there, make sure you're in the right spot. My other hand is going to be placed around the metatarsals. I'm then going to apply an inward pressure with my hand squeezing around the foot. Any replication of neurological signs such as burning or tingling would be a positive sign for this test.
The test for Morton's neuroma. So what you're going to do first is have your patient sitting long, sitting with their foot hanging off the table. And the first thing you're going to do is squeeze their first and their 5th metatarsal looking for any pain. And then you're going to squeeze their transverse arch on the interdigital nerve looking for pain. And then you're going to take a pencil and poke it between the eraser, between the metatarsals, seeing if they have any pain there.
Stair stepping is a low-impact weight-bearing cardiovascular activity that can be easily done at home. Modify this exercise with the use of a handrail or the assistance of a spotter to limit the amount of trauma placed upon your feet. Begin by standing with your feet shoulder-width apart, step up with your right foot, then up with your left foot. Step back down with your right foot, then back down with your left foot. Repeat this 10 times. Interval walking is another useful exercise for individuals with PAD. Begin by walking at a low to moderate intensity for 5 minutes. On a 4-point intensity scale, this should feel as if you're working at about a 2. Continue walking until you feel your symptoms reach a 3, then take a break. Walk another 5 minutes at a low to moderate intensity, or again until your symptoms reach a 3. Calf raises are a good dynamic stretch for circulating blood flow and preventing PAD-related complications. Stand on the ground or on the edge of a small platform. Use your calf muscles to extend your ankles and slowly raise your body upwards while exhaling. Hold for 2 seconds, then slowly return to the ground. Repeat 10.
See, the leg would become a little shorter. So supine sit-up test is not a bad test for finding out if there's mutations or counter-mutations of the innominate bone of the pelvis. Okay, we're going to do the Patrick Faber test, and it tests for pathologies of the hip, SI. It may show spasms of the iliopsoas and shortness of the abductor. So I'm going to bring your leg up in a 4 position here. I'm going to hold my left hand over the ASIS. I'm going to apply pressure in a downward direction. And she actually kind of tests positive to this. What should normally happen is the leg should come down about equal the height of the other leg, close to well, maybe 2 or 3 inches off the table. And hers doesn't, so it's a little positive for either a hip problem, SI, or iliopsoas shortness or abductor shortness. Okay, good. Okay, we're going to do a muscle length test of the iliopsoas called the Thomas test. We're going to show the iliopsoas first and then the rectus femoris second. So we're going to bring the leg up here and hold that and pull it up. If the iliopsoas is positive, you're going to get a shortness like this. The leg will be bent and the heel may even be up, but you'll get 2 or 3 inches underneath the knee here showing the iliopsoas is shortened. That's a Thomas test, a muscle length test. Now, we're going to show you next the rectus femoris test. Okay, we're going to do the second part of this test for the rectus femoris. I'm going to have Megan lay down and grab her knee and bring her knee up. And we're looking at the rectus femoris. Now, the rectus femoris, if it was normal, it should be at 90 degrees, but hers, let your leg relax. It's a little short, so her rectus femoris is a little short here. It should be more of a 90-degree position, but it isn't. The other thing is you can take a look at the tensor fascial lata iliotibial band. If the leg is out like this, turned out a bit, then you may have problems with the tensor fascial lata iliotibial band. But her rectus femoris is a little short. The leg doesn't go, the knee doesn't go to a 90-degree angle.